Hello, please tell me who you are and what you're doing.
Well, my name is Lucien Engelen. I'm director of the REshape and Innovation Center at the Radboud University Medical Center. And we're trying to innovate our ways through the patients themselves, actually.
Could you be more specific?
Well, a lot of innovation in healthcare is being done without patients themselves, without even asking them. So that's one of the perspectives that we are bringing into it and bringing to the table to, together with patients, try to innovate on those kinds of things that keep them longer at home or bring them even sooner back to their own homes, actually.
So where do you find those patients?
In our own university medical hospital,
Yeah.
for one. And the other thing is that we are trying to set up trials and innovation boot camps as well to boost these kind of innovations. So at our own facility, but also abroad.
So that means talking to patients, asking them questions, and then testing whether the innovations you thought up are working.
Yeah, our projects always will start with listening to patients, not talking to them, but asking them how could we. No, that's okay. But it's some kind of fetish for me, but that's the thing that everybody in healthcare seems to skip. Listen to what patients have to say. We listen to them, but we hear them, but we don't really listen. So that's one of the things that we are doing. It's about 2 years ago, I appointed a chief listening officer into my team. And the thing she does is listening to patients on a daily basis in our waiting rooms, in outpatient clinics, and try to figure out how we could help them to make their life with this disease a bit better.
So that's where it all starts. Yeah. And why are you here? What's your story?
Well, my story is that I'm a friend of Jurian van Rijswijk. For one, I'm in the program committee. And when Jurian had the first idea to set up this conference 2 years ago, he also was working together with us at our TEDx Maastricht conference, which also is all about healthcare. So it seemed to be a logical step. And we are bringing in patients' perspective as we are a university medical hospital and try to set up a good program with that.
Is it important for you to be here?
Oh yes, it is. Not only for the people speaking, but obviously also from network's perspective. A lot of people trying to change healthcare with games, for instance, are stepping into this conference. So it's a good way in 2 days actually to meet a lot of people, get some great ideas, inspire some people, and drink some good coffee.
Do you see any growth? Is it bigger than last year?
Oh yes, it is definitely.
Yeah?
It's not only bigger in terms of people, but it's also bigger in terms of content. It's more specific, it's more focused on what patients should need to do and can do actually. So I think over the next years, this will evolve in the major event in healthcare in Europe.
Really?
Yeah, I think so.
Oh, and so is it coincidence that it happens here in Holland? If you say the biggest thing in Europe, or
I don't know. I think there's
are
a lot
we
of
good at it?
I think we are,
Yeah.
without bragging. There's a lot of creativity going on in the Netherlands, especially in Amsterdam, looking through all kinds of online stuff. It's becoming the melting pot of the world actually at present. So it's a perfect situation to start off with a healthcare perspective. So I think it will be growing on a very neat way.
Yeah. Why are games in health important?
For me, games are similar into seducing people, and the biggest problem in health, so not in healthcare, is trying to seduce people into a better lifestyle, stop smoking, start moving actually. And so you need, like BJ Fogg tells us every time again, you need baby steps. And once serious or applied games, what some people like to call it, come into the position, it's a possibility and it's a chance actually. So we should try to engage on that on a very high level.
Why do we need games for our health? Can't we do without?
I don't know. Yes, I think we could do without, but life is a game. We try to engage with everything surrounding us. And so from that perspective, I think games aiming on health or healthcare could help a lot, not only for patients, but for instance also for healthcare professionals in trying to train them for specific needs or specific programs or logistics or questionnaires for patients, for instance.
Yeah. What's your favorite example of a game for health?
Wow, I'm biased. Geriatrics, which is one of the games that's been developed from our own university hospital.
What does it do?
What it does is that picture doctors that come from med school,
yeah,
and they are trained on anatomy, on every kind of disease you can imagine, but nobody talked ever about money. And here they are, ready to be a doctor, and suddenly everything also runs through money. So you have to have a clear perspective on what the impact, for instance, in costs of an MRI or a certain procedure is. Mm-hmm. And doing this by a serious game brings to the table for them, much earlier than they will encounter that in real life, these kind of specific questions. And in the end of the day, they should know what procedures cost to make a good balanced decision.
Is that something new, or is that a problem of hospitals from all times?
No, I think it's from all times, but this budget pressure at present, and budget cuts actually, and for instance also in 2040, in the Netherlands alone, we will suffer from a shortage of 400,000 nurses alone. So we have to come up with smart things, and I think this is one of the possibilities that could work. But it's always an and. It's not or.
No.
Some people tend to think it's only serious games or it's only education. You have to need an array for that.
Do you see an important trend in Games for Health? Is it a money-driven thing, or is it something else?
Well, yes. I think the trend I see at present is that it's mainly research-driven, which from one perspective is okay, but from our perspective it should be from patients' perspective. Mm-hmm. So I hope actually that in the next years will change a bit. Sometimes it looks like, hey, I'm looking for research and I'm doing this by a serious game, which I think is some kind of an adverse way of thinking of it. Mm. So I hope that trend, which I see starting up right now, will come through. Yeah.
So how do you change this field?
I think the only way to do that is to actually do it. Yeah. There's a lot of talking going on, for instance, on serious games, and the only way to actually understand how this works is actually doing it. So that's the reason why we in our REshape and Innovation Center, within 2 weeks, will open a game lab together with Lucien and his company, where 2 days a week, a serious game consultant will have a consultation hour for doctors, physicians, but also for visitors and patients, to try to get the catch on that.
Okay. Sometimes people seem to think that serious games or games for health are a solution for, well, everything, for a lot of things. That's probably not true.
No, that's correct. That isn't true. That's what I said. It's an and situation. You can use serious games to help a bit, and on some fields a bit more, but it's always a multi-level approach, with which everything in healthcare is. It's about ethics, it's about money, it's about compassion, but it's also about technology and, for instance, serious games.
What does the world look like in 10 years' time? Or is 10 years still too early for a real change?
That's a good question. I think on the level of serious games, I think there will be an enormous boost over the next 5 years. Healthcare seems to have this kind of cycle in 7 years. It takes 7 years to get something implemented in healthcare. So within the first cycle of 7 years, I think it will boost enormously, and then we will get a shakeout of real, serious and applied games that actually are helping people to change their lives.
So that's important, that they have a stamp of approval,
Well, the stamp of approval will be if patients are using it.
Yeah.
I'm not looking for some kind of check mark or something like it.
No.
The market will tell.
Okay.
Yeah.
So if they will use it and they think it helps, it's okay by you?
We will validate that from a science perspective, of course, but once that's been done, it's up to people themselves, I think. And it's very early work. There's not a lot information on it yet, and it's a growing field, which is great that Games for Health in Europe facilitates this discussion from the Netherlands.
So, to round up, what game do you play yourself for your health?
surviving. Maybe that's a good
in a psychological sense, or
yes, I think it is. There's a lot of stuff going on technology and behavioral change and cultural change, politics, ethics. It's a tough field in healthcare at present.
Yeah.
And so all of us are looking to find a way to cross that border into a compassionate healthcare field where people can participate as much as they would like to.
But why is it a hard field?
Well, it's a tough field since you're trained as a physician, for instance, for 17 years to do stuff like clockwise. All of a sudden, somebody steps up, a patient, and asks you to do it counterclockwise. That's a shift, for instance. And so it has to be settled in educational systems as well. And that takes us at least 10 to 15 years to get it in position. So that's the reason why I say it's a tough field.
Is it a coincidence that you use the word serious games all the time instead of games for health?
One calls it serious game, the other games for health or applied games. It's a definition question.
Yeah,
maybe.
but it's not because you think it's important for it to be called serious.
No. Let's bring some romance in it. Let's bring some fun in it, and let's bring some emotion in it as well. So for us, it's not about cold gaming. But it's more like bringing it as a serious game that people understand that you could benefit from it. Also as a healthcare professional, to cope with the big challenges that we're facing.
Okay, thank you very much.
Thanks very much.